The Gaucher Initiative, a collaboration with Project Hope that began in 1999 with the object of providing access to therapy to appropriate Gaucher disease patients in Egypt who have no means of obtaining treatment on their own. Since its inception, hundreds of eligible patients in Egypt have received treatment. Additionally, the program has helped build the capacity of the Egyptian health system to properly diagnose, treat, and manage Gaucher patients, and has contributed to a country-wide understanding of the disease.
The Gaucher Initiative was really the brainchild of Genzyme's founder and former CEO, Henry Tremere.
It really is a realization of Sanofi's bold vision to treat any patients anywhere on this planet, regardless of their means to pay or what the infrastructure is to make available biologic therapies for them.
The Gaucher Initiative program have started in Egypt at a time where Gaucher was not known even as a name. We started with 12 patients identified and no ecosystem to be able to support them, whether from a medical perspective, diagnostic services, or the drug itself. The Gaucher Initiative program came not only to provide the product, but also to build that ecosystem around them, to be able to create a sustainable environment where these patients can receive best of care.
It was clear from the beginning that we would need a medical committee of experts with substantial experience in Gaucher disease here in the United States, and then, of course, the expert committee in Egypt to develop a sustainable, culturally sensitive program.
The purpose of the committee really was to help the overseas physicians who would be administering the drug on dosage, on diagnosis, and on complications that might arise during the therapy.
And it was quite clear that we were in sync with those physicians right from the beginning.
Egypt was the first country in the Middle East to receive treatment, whether free or paid. I cannot ever forget how they were helpful in providing us with technicalities, information, building up a committee of consultants who were doing it as a gift of kind to share with us their information, their help, discuss the patients one by one, and how to deal with their problems as we go on. This was very helpful for us all.
The U.S. Medical Advisory Board went out to Cairo and other cities, and we saw patients together. And that became a wonderful platform for training, acquiring new knowledge for both them as well as for us.
There's a lot of camaraderie, and that catalyzed research. Project Hope's role was to implement all aspects of the program. So we identified patients for enrollment in the Gaucher Initiative. We operated the medical advisory boards, imported and distributed the medication, and also conducted day-to-day communications with all of the patients and families. So today there's a nationwide network. Patients all over the country can be diagnosed. They can be referred to one of 7 specialized centers for the treatment of Gaucher disease. And in those centers, there are tremendous clinical experts who provide them outstanding care.
The impact of the Gaucher Initiative program in Egypt has been truly transformative for hundreds.
One thing that really impacted me over 15 years of observing this program is that parents across the entire globe will do anything to help their children.
كان مسألة صعبة جدا على إني أطفال تعبانين على طول مش عارفين أي مرض مش عارفين مرضهم إيه أو عارفين لهم أي علاج. وأسعد لحظة أول ما الدكتور خالد اتصل بينا وقالوا إن الأولاد دخلوا المشروع الأمريكي. كانت ديت سعادة ما تتوصفش.
Over the past 20 years in the Gaucher Initiative, I am most proud of hoping to build a sustainable healthcare system for one of the most complex genetic disorders. And I think that this is truly an enduring contribution.
It was Genzyme's long-term commitment that enabled us to achieve so much. We helped people, but I think even more importantly, we built in-country capacities that are going to support patients for decades to come.
The future of the Gaucher initiative in Egypt actually is something that no one would have envisioned when this program started, which is, I believe Egypt is going to generate new knowledge that is going to be of benefit to everyone else in the world.